Have you ever quietly wondered if the changes in your body were just part of aging, or if maybe something you stopped doing years ago could be part of the reason? For many men after 60, touch becomes distant, silent, even forgotten. But what if that silence is costing you more than you realize? Today we're going to open a conversation rarely had but deeply needed. Not about shame, not about indulgence, but about how one simple act, when understood and done with care, can support your vitality, your mood, and your health. If you're ready to listen, I promise it's worth staying for. Let's begin. Secret 1. Mindless masturbation can lead to numbness and ED. Let me share something that far too many men carry quietly, often with shame they can't even name. Over the years, I've spoken to hundreds of older patients who've walked into my office with their heads slightly lowered, voices hesitant, unsure if they're allowed to bring up what's truly on their mind. And when we finally get honest, when we create enough space for truth, I ask gently, "Do you still masturbate?" Almost every time there's a pause. Then comes the whisper, "Yes, but it doesn't feel like it used to." Or, "I can only finish if I do it the same way every time." And sometimes the words land with quiet pain. "It's like my body forgot how to feel." What many of these men never knew is that how you touch yourself matters. That rushed, mechanical, disconnected self-pleasure isn't harmless. It trains your nervous system to respond only to a narrow routine. Same hand, same motion, same mental pattern. And over time, that conditioning becomes so specific, so rigid, that your brain forgets how to respond to anything else. Your sensitivity drops. Erections become weaker. Real-life intimacy feels foreign, awkward, even too slow to spark anything meaningful. It doesn't stop there. I've seen men spiral, not because their bodies were broken, but because their connection to sensation had been overtrained in the wrong direction. What started as a habit for relief slowly turned into emotional withdrawal. They began avoiding closeness, not out of choice, but because it no longer brought comfort. This kind of disconnection is real. It leads to frustration, shame, and sometimes even depression. Some men develop conditions like porn-induced erectile dysfunction, delayed ejaculation, or even full anorgasmia, the inability to climax at all. And the cruel part is, they never realize it's something they unintentionally caused over years of unconscious repetition. But I want to be very clear. This is not about blame. This is about awareness. Because the truth is, your body can relearn. The nervous system is capable of healing, but it requires a different approach, one that is slow, present, and emotionally connected. Masturbation is not the enemy, but doing it mindlessly is like putting your car in gear and stepping on the gas without ever touching the wheel. You move, yes, but without direction, and eventually you crash. Now here's the twist that surprises many. While mindless self-pleasure can dull your senses, complete avoidance, especially after 60, can also cause quiet, invisible harm. And that's what we'll explore next. If this speaks to you, if it feels like a mirror you didn't know you needed, leave a comment with "still" with you and let's continue. There's something important waiting in the next secret. Secret 2. Masturbation reduces prostate congestion and inflammation. Let me tell you about someone I'll never forget. His name was Robert, a 68-year-old retired firefighter. Strong-willed, quiet, the kind of man who had spent his life putting others first and rarely talked about his own needs. He came to see me not because he was worried, but because he was exhausted. He told me he was waking up 5 or 6 times every night just to urinate. He felt a dull pressure in his lower abdomen, an ache deep in his pelvis, and a growing sense that something just wasn't right. Like many men his age, he assumed it was just another part of getting older. What caught him off guard was the question I asked next. "Robert, when was the last time you ejaculated?" He looked at me stunned. Then, almost embarrassed, he said, "Honestly, I haven't since my wife passed. That was years ago. I figured that part of life was just over." And in that moment, I saw what so many older men carry quietly inside. The belief that masculinity, sexuality, and self-touch must be packed away with age. That after 60 or 70, your body no longer deserves attention in that way. But here's the truth I shared with Robert and the truth I want to share with you now. Your prostate doesn't retire just because you do. It keeps producing seminal fluid every day, and when that fluid isn't released, it accumulates. It stagnates. And that's where problems begin. This backup of fluid creates pressure and inflammation. It irritates the prostate and surrounding tissue, leading to symptoms like nighttime urgency, weak flow, dribbling, and even pain. Men often assume these issues are unavoidable with age, but in many cases, it's not age, it's a traffic jam inside the body. Your prostate was never designed to hold on to unreleased fluid indefinitely. And when it does, the consequences ripple outward into your sleep, your comfort, your mood, even your long-term health. Here's something else most men don't hear often enough. Chronic inflammation in the prostate has been linked to a higher risk of prostate cancer. No, that doesn't mean abstaining causes cancer, but it does mean regular ejaculation may help reduce inflammation and support a healthier internal environment. One landmark study from Harvard, tracking nearly 3,000 men, found that those who ejaculated at least 21 times per month had a significantly lower risk of developing prostate cancer. That's not folklore, that's science. But let me bring this back to Robert. Once he understood what was happening inside his body, his whole perspective changed. He didn't see masturbation as shameful anymore. He saw it as a form of self-respect, a way to care for his health in a deeply personal yet powerful way. Slowly, his symptoms began to improve. He slept through the night again. The aching subsided, but perhaps most meaningful was the change in his spirit. He started to smile again. He walked into my office with a little more light in his eyes, because reclaiming this part of himself reminded him he was still alive, still whole, still worthy of attention and care. Neglecting this part of your health doesn't just lead to a few restless nights. It can mean years of unnecessary medication, procedures, or even surgery. And more than that, it can mean carrying around a silent burden of guilt or embarrassment that has no place in a healthy life. You would never ignore your heart. You wouldn't neglect your lungs. Don't forget your prostate. And don't underestimate the power of simple, consistent care, both physical and emotional. Because in the next secret, we'll uncover something even more hidden. The way that emotional shame and silence around self-pleasure can actually worsen physical symptoms and disconnect you from your own body. It's a truth most men have never heard, but one that could change how you see yourself forever. Keep watching. This next part may just open a door you didn't know was closed. Secret 3. Shame around self-touch damages your mental health. There is a kind of silence I've come to recognize in many older men. It doesn't show up in words, but in the spaces between them. It's in the way their gaze drops when I gently ask about sexual habits. It's in the nervous laugh that quickly changes the subject when I mention masturbation. It's in the way they say, "Doc, I don't do that anymore. That was for when I was younger." But what I hear behind those words is not disinterest, it's loss. Not the loss of desire, but the quiet erosion of permission. Somewhere along the way, many of these men were taught that after a certain age, it was wrong to still feel, wrong to still touch, wrong to still want. And this silent shame, passed down from old beliefs, is one of the most damaging forces working against their health today. For many of you, childhood was a time of restriction. Maybe you were scolded. Maybe you were told it was dirty, sinful, weak. Those lessons didn't vanish with age. They sank deeper, into the nervous system, into muscle memory, into the relationship you now have with your own body. As the years passed, that shame slowly tightened its grip. You stopped reaching for yourself, not because you lost the desire, but because you felt you shouldn't. You stopped honoring that part of you, even though it still longed for connection. And over time, that emotional disconnection quietly becomes a physical one too. What most men don't realize is that healthy self-touch is more than just sexual. It is chemical, it balances stress, it releases dopamine, which lifts your mood, It releases oxytocin, the hormone of trust and connection. It lowers cortisol, the hormone that fuels anxiety and inflammation. It even improves sleep, clarity, and emotional resilience. But shame interrupts all of that. Shame tells your brain to shut down those healing signals. Shame tenses your body, raises your blood pressure, and loops your mind into guilt without end. And when that shame becomes chronic, the consequences ripple through every part of your life. Anxiety, depression, isolation, even cognitive decline. Let me tell you about someone I worked with named Harold. He was 72, recently divorced, with no major health concerns. But when he came to see me, he was tired in a way no sleep could fix. His voice was low, his energy flat. He told me he hadn't had any kind of sexual activity, not with a partner or by himself, in over 10 years. I figured that chapter was just over, he said. But beneath his words was something deeper, a quiet grief, not just for the loss of intimacy, but for the disconnection from himself. We didn't start with anything complicated, no medications, no big goals, just small, mindful steps to help him reconnect with his own body in a way that felt safe and kind. No guilt, no judgment. Over the next few weeks, something began to shift. He walked with more confidence, he laughed more freely, he slept more soundly, his blood pressure stabilized. He wasn't just improving, he was returning to himself. And that is the hidden cost of shame. It doesn't just take away pleasure, it takes away vitality. It convinces you that to grow older is to grow colder. But the truth is, you are never too old to touch yourself with dignity, never too old to feel affection, warmth, and presence within your own skin. This is not about indulgence. It is about healing, about claiming what should never have been stolen from you in the first place, your right to feel whole. Now imagine this. If emotional shame has that much power to weaken the body, what happens when hormonal decline begins to join in? Because the next truth may surprise you. Your testosterone doesn't just decline with age. It declines faster when you disconnect from your sexual self entirely. And when that balance is lost, it affects more than just libido. It touches everything, your energy, your focus, your resilience, even your sense of purpose. If this is resonating with you, take a moment to comment, release shame, and hit subscribe so you don't miss the next part. Because what comes next could help you restore not just your chemistry, but your spark. Let's keep going. You're ready for this. Secret 4. Testosterone is stimulated by sexual activity, even solo. There's something I wish every man over 60 could hear with open ears and an open heart. It's a truth that many only come to understand when they've already begun to feel like a shadow of who they once were. You see, testosterone, the very hormone that fuels your strength, your drive, your energy, and your spark, does not simply decline because of age. That's only part of the story. What most men don't know is that testosterone levels also fall when you stop living in a way that tells your body you still want to feel alive. When you push your sexual energy to the background, suppress it, or bury it under shame or routine, your body listens. It begins to dial things down. Your brain, always adapting, says quietly, "He must not need this anymore." And it starts redirecting its efforts. Blood flow slows, muscle tone fades, your belly softens, your sleep becomes more restless. And most painful of all, the inner fire that once gave you your sense of purpose and presence begins to dim. Not because you are getting old, but because you've stopped reminding your body that you are still here, still vital, still full of desire, even if that desire takes a different shape now. I once treated a man named Martin. He was 73, a retired carpenter with hands that had built a lifetime of work, but shoulders that now slumped with quiet exhaustion. "I guess I'm just slowing down," he told me. But when we ran his labs, his testosterone was barely above deficiency. When I asked him about intimacy, even solo, he simply said, "There's no point anymore." That belief, more than any number on a chart, was what concerned me most. Because when a man stops seeing his sexuality as part of his identity, the body starts to follow. So we work together. No pills, no lectures, just simple, consistent practices to help him reconnect to himself. Not for performance, not for anyone else. Just for the sake of presence, of awareness, of reminding his body, I still care. And something remarkable began to happen. His posture improved. He laughed more easily. His hormone levels rose. He started moving again with intention. The light came back to his eyes. That's the thing about testosterone. It responds not just to biology, but to engagement, to touch, to imagination, even to the quiet spark of anticipation. Science backs this up. Studies have shown that even solo sexual stimulation can lead to temporary increases in testosterone. Engaging with your erotic energy in a mindful way doesn't just feel good, it supports your hormones, your mood, your heart, and your mind. Because your body is built to respond to connection, even when it's with yourself. Low testosterone isn't just about libido. It's linked to fatigue, depression, diabetes, heart problems, and even cognitive decline. And most men never realize how much they've drifted away from themselves until that emptiness feels normal. But the way back doesn't require youth. It doesn't require anyone else's approval. It begins with reclaiming your own body in the privacy of your own space, without guilt, without shame, and with the dignity you deserve. And if that truth surprised you, just wait. Because what I'm about to share next is even more critical. It's something most men unknowingly sabotage every time they touch themselves the wrong way. And correcting it could change the way you age from this moment forward. Secret 5. Erectile function is a use it or lose it system. There is a quiet lie that far too many men begin to believe after turning 60. It whispers, if I'm not having sex, then erections don't matter anymore. I've heard it from strong, wise, accomplished men who've survived loss, illness, and change. They say it with a shrug, as if this part of life has quietly closed its doors for good. But here's the truth that most doctors rarely say aloud. Erections are not just about sex. They are about blood flow, nerve integrity, vascular health, and ultimately about the very foundation of your longevity and vitality. I remember one patient, Dennis, a 69-year-old retired professor. He was sharp, thoughtful, and deeply introspective. After losing his wife, he spent the next 6 years in solitude. He told me he hadn't had an erection in all that time, not because he was unable to, but because he thought it no longer mattered. He had made peace with what he believed was just getting older. What Dennis didn't know was that his body wasn't patiently waiting for him to return to it. It had already started quietly shutting down. Your penis, like every part of your body, thrives on activity. Without regular use, the smooth muscle begins to weaken. Blood vessels lose their flexibility. Oxygen-rich flow becomes limited. The delicate tissues can develop micro tears, and over time, fibrosis, the hardening of soft tissue, can set in. Nitric oxide, the essential chemical that helps trigger erections, begins to fade. And all of this happens not because you're old, but because the system is no longer being reminded that it matters. Here's what most men don't realize. You don't have to be actively seeking sex to maintain erectile health. You don't even need to feel intense arousal. What matters is engagement, gentle stimulation, intentional presence. When you experience regular erections, whether through conscious self-touch or even non-sexual arousal, you're not chasing pleasure. You're preserving function. You're keeping the blood flowing, the nerves awake, and the tissues healthy. You're keeping the door open, even if no one is walking through it right now. And the consequences of ignoring this are not just physical. As the body becomes less responsive, the mind begins to follow. Confidence quietly slips. A man who once stood tall may begin to feel faded, not because life has passed him by, but because he no longer feels anchored in his own physical identity. For many, this disconnection grows into a sense of isolation, depression, even early cognitive decline. I've seen it happen more times than I can count, not in dramatic moments, but in quiet years of neglect. And every single time, it was preventable. This isn't about performance. It's about preservation. It's about reminding your body that you're still here, still alive, still worthy of feeling whole. So even if you're not in a relationship, even if intimacy feels far away, your body still needs this. You can honor that need with quiet dignity, without shame, without apology. Now, maybe you're wondering if keeping the system alive is so important. What are the hidden forces that work against it? What are the habits that slowly strip away sensitivity and joy without you even noticing? That's exactly what we'll uncover next. Because there is one modern habit so common, so overlooked, that's rewiring older men's brains every day without them realizing it. And it's time we brought it into the light. Secret 6. Porn changes your brain, but you can take control. Let's talk about something that many older men carry in silence, tucked away in the corners of private life: pornography. I know that word alone might stir discomfort. Maybe it brings a flush of embarrassment or a desire to look away. But if you're still here, I invite you to stay open. Because what I'm about to share could reshape how you view your mind, your body, and your sense of masculinity in this stage of life. I've had men in their 60s and 70s come into my office and tell me, often after a long pause, that they still watch porn. Not because they're addicted, not because they crave thrill, but because it's one of the few ways they still feel something. Many live alone. Some are widowed, others quietly divorced. For them, it's not about lust. It's about longing. It's about trying to touch a memory of closeness, a flicker of vitality, a sense of connection. But what they don't realize is that the kind of porn available today is drastically different from what they first saw in their youth. What once was a magazine tucked in a drawer or a slow, suggestive scene is now a flood of high-definition, rapid-fire, overstimulating content. And the aging brain, no matter how sharp, is not built to absorb that intensity without consequences. Every time you watch these fast-paced videos, your brain releases a surge of dopamine, the feel-good chemical tied to pleasure, reward, and motivation. But over time, that constant stimulation rewires your mind. Real-life touch begins to feel dull. Your brain starts craving the artificial highs, and simple connection feels too slow, too quiet, too ordinary. This isn't about taste, it's about chemistry. Your nervous system adapts to what you feed it. And when the only arousal comes from exaggerated fantasy, your body forgets how to respond to reality. I've seen men develop what we now understand as porn-induced erectile dysfunction. They can perform when watching, but without it, their bodies don't cooperate. Even solo touch without screens becomes difficult, and the emotional toll is heavy. They start believing they're broken. They carry shame. They pull away from others, but they rarely make the connection. They don't see that the very thing they turn to for comfort slowly drain the joy it was meant to give. But here is what I want you to hold on to. This is not permanent. You are not broken. You are simply out of rhythm with yourself. And the good news is that rhythm can be restored. Your brain, even in your 60s, 70s, or beyond, still has the power to change. It can reset, it can relearn, and it starts by stepping away from overstimulation and stepping back into presence, into imagination, into slow, grounded sensation. Some men choose to take a full 30 days away from all visual material. Others taper off gradually. There is no one right way. What matters is the intention, that you give your nervous system a chance to breathe again, to rediscover what real pleasure feels like when it's not filtered through a screen, to make room for sensation that is yours, not scripted by someone else. This isn't about giving up pleasure. It's about reclaiming it, making it real, making it meaningful again. And if porn has dulled your sensitivity, the next truth may feel even more personal. Because while digital content can hijack your brain, emotional and physical isolation can quietly break your spirit. And what happens to a man's body when he goes untouched for too long is a reality we cannot ignore. Let's talk about that next. Secret 7. The most dangerous mistake is isolation. Of all the silent dangers that follow men into later life, There is one more damaging than low testosterone, more destructive than overstimulation, and more corrosive than any number on a medical chart. It is isolation, not just living alone, but something deeper, the kind of quiet that settles in when you no longer touch, no longer reach, no longer connect with your own body. Not because you don't want to, but because somewhere along the road, you were taught that older men are supposed to move on from that kind of closeness. I remember a man named Charles, 76, a retired engineer with a gentle voice and an orderly life. He came in for a routine checkup, and somewhere in the conversation, I asked him about physical connection. He paused, then said almost casually, "I haven't been touched in over a year. Not a hug, not a pat on the back." He didn't sound sad. He sounded like a man who had simply accepted that chapter was closed. But what Charles didn't understand is that touch is not optional. It is as vital as sleep or water. Our bodies, even at 70 or 80, are wired to respond to physical connection. And when that connection disappears, something inside us begins to dim. Without touch, oxytocin levels fall. Cortisol creeps upward. Blood pressure rises. Sleep becomes shallow. The immune system weakens. And the brain begins to slowly numb itself as a way to cope. You don't notice it at first. Maybe you skip a morning routine. Maybe you avoid your reflection. Maybe you stop imagining anything warm or pleasurable at all. And it often starts in the most private place of all, the bedroom. When a man stops touching himself not out of peace but out of resignation, the nervous system starts to believe he has checked out. And that withdrawal becomes a loop. The less you feel, the less you try. The less you try, the less you feel. Until you wake up one day and realize it's not just arousal that's missing. It's purpose, identity, presence. This is the most dangerous kind of fading, the one that comes quietly over time, with no clear breaking point. And it has been tied to serious risks: depression, cognitive decline, heart disease, even early death. Not because the body's old, but because the self has been slowly abandoned. But I want to be clear, this is not about blame. Life changes, grief happens, distance happens, but disconnection does not have to become your story. You still have the power to come back, and it starts not with grand gestures, but with something simple: giving yourself permission to touch, to feel, to return. That touch, whether sexual or simply present, is a declaration, a reminder. I am still here. I still matter. I still want to live fully in this body. And if these words have stirred something in you, then stay with me, because what comes next is the beginning of something new. A simple, powerful daily ritual I give to my own patients. One that helps rebuild sensitivity, restore connection, and bring you back to life, one touch, one breath, one day at a time. If you've stayed with me until now, it means something inside you is still reaching for connection, for clarity, for life. This journey was never just about the body, it was about dignity, about remembering that even in your 60s or 70s, you are still worthy of warmth, of presence, of feeling deeply alive. If today's message touched you, type "still alive" in the comments and gently tap subscribe so we can keep walking this path together. In the next video, I'll share a daily practice that helps bring your body back to life in the most natural way. Until then, be kind to yourself. You still matter.